Dr. Gautam Deshpande and Dr. Nicholas Rennick. Welcome back to the Tokyo Living Podcast.
Thank you. Thanks for having us.
Regular listeners and viewers will be familiar with both of these guys. Thank you both for taking your time out from saving the world, saving lives, and making the world a better place to join us today. We're going to talk today about a recent meeting that you guys had with the Tokyo governor, and how this is potentially a first step towards maybe trying to replicate more of a sort of Western style hospital within Tokyo. So tell us about it. How did this come about?
All right. Well, I guess I'll field this one. So we have a colleague, and he's a senior member of the Japanese medical community. He's very well respected and well known around Japan, and he trained in infectious diseases about 30 years ago in the United States, and he came back to Japan after his training, and he's got a lot of ideas and he sees a lot of places in the Japanese healthcare system where he wants to make changes. And those changes that he wants to implement are often sort of bringing the Japanese healthcare structure more in line with the way we organize clinics, hospitals, and healthcare in the United States. And this is a product of his training. So one of the ideas that he's working on right now is to find a large hospital in Tokyo and restructure it from a traditional Japanese hospital model into something that looks a little bit more like, what we kind of consider a Western care model for hospital care, and see if by repurposing it that way, it'll be more useful, not only for the Western community living in Tokyo, but also for the Japanese community living in Tokyo. And that's sort of the basic foundations of this idea, this project that led to Nick and I meeting the governor. And the pitch there was, if we can get the governor on board with this, given that the governor does want to make Tokyo an international city and maybe even an Asian financial hub city, if we get them on board, we can actually get the ball rolling. So that's the sort of the groundwork. Nick, what's your perspective on this?
Yeah, absolutely. I think it's really just about acknowledging what works well in the current system and what doesn't work so well. And I think, both of us working at Tokyo Medical Surgical, we offer quite good outpatient care. And I think most patients feel that, the quality of primary care that they're able to receive is in line with what they would get in their home countries, and sometimes even better. But, when it's tricky when it comes to the stuff that only hospitals can do, so particularly that's emergency medicine. Sunday night, you fall over and break your arm, right? What do you do? I think a lot of our listeners will be familiar with feeling quite uneasy about, what exactly do you do in that sort of situation when really only a hospital can deal with it. And I'm sure many people have had either personal experiences or experiences of those around them of real, horror stories where they've kind of gone to a hospital and waited for hours and people have not spoken English and they've been kind of thrown about or even told not to go to a certain hospital.
Or even just waited for hours in an ambulance while they try and find a hospital that's available.
Exactly. And, a lot of people have had really unpleasant experiences with the acute medicine or even being as an inpatient. So I think, this meeting was really about saying, look, some things in Japan work really well for expats already, but some parts of it, leave a lot to be desired, and trying to work on the bits that sort of need a little bit more attention.
Yeah. And what were the sort of main points, the main differences that you highlighted? Obviously, maybe the things that the positives that the Japanese hospital system has going for it, and then the things that you could potentially bring from a Western style of management.
Well, I think the positives are, of course, this is a wealthy country with a lot of technology, a lot of diagnostic capabilities. So that when you do go to the hospital, and let's say you need an MRI and a CT scan and 100 tests, all of those things are available. So it's not for a lack of wanting those things. But I think where the improvement can happen is really how those things are utilized. And that highlights the main difference between, say, U.S. style hospital care. We call it hospitalist medicine, and the traditional Japanese model of going straight to a specialist.
Mm.
And the difference is there is that not every disease is so cut and dry as a broken bone. So even something like abdominal pain or chest pain isn't always the gut or the heart, respectively. The gut can be causing chest pain. The heart can be causing abdominal pain. And from that perspective, that's where a general physician working in the hospital, what we call a hospitalist, what the Japanese are only recently calling a a hospital-based generalist. That's the benefit of that model, where the patient sees that generalist in the hospital setting first and sort of gets the details teased out appropriately with the right tests, the right images. And then once that's taken care of, once that's sort of parsed out appropriately, then the generalist can take care of the patient, him or herself, or send the patient to the right specialty. And that's the general organizational model that we're trying to go for, because we think that that actually works better for patients.
Yeah. Yeah. And what do you foresee, or what I guess the main barriers that people would talk of in terms of trying to adopt that type of model?
Nick, do you have an opinion on that?
Yeah, look, I think the main issue in Japan is this sense of responsibility. Is my personal take on it. I think they've, as you're saying, they've got their respective specialties and they are excellent at their specialties. And the facilities are really world class in a lot of these hospitals. But the issue is that whether they take responsibility for the patient, they will only do it if they feel really up to it. So that becomes so for this abdominal pain case, for example, someone's got abdominal pain. Now the GI doctors will see them and they'll go, you know what? We've done some scans of the abdomen. We don't actually think it's the gut. And, we don't feel that confident in our knowledge about any other system of the body to even kind of do an investigation on that. So it's not us. We can't take responsibility for this patient. And then they'll try and sort of pass it on to someone else. And we get this going on from not just specialist to specialist, but from institution to institution. So, for example, the emergency departments will often say, sorry, we're full. We can't take any patients. And to us, from a Western perspective, we're kind of like, what? You got 6 beds and 6 beds are full, so you're done for the day. What is that? But from their point of view, it's about if they take you on, they want to be kind of fully responsible for it. So if they're taking that step of taking responsibility for the patient, they want to make sure that they're able to do everything perfectly according to textbook. So I think in terms of the biggest barrier to kind of implementing these sort of things is that sense of sense of responsibility. Without, at the moment, there are no generalists who have enough training to see every system and deal with a wide range of complaints. So when someone turns up at the hospital and has undifferentiated illness, it's often easier for the hospital to kind of say, you know what, we can't deal with that right now. We don't have the appropriate staff. We don't know what it is. So go and see your local doctor or whatever. I think overcoming that mentality and basically, I guess from the Australian perspective, just have a go. This have a go mentality of okay, maybe you are a little bit outside your comfort zone here, but doing something is still better than doing nothing. At least kind of seeing the patient, taking a history, doing an exam, starting some investigations. And then when you figure out what it is and that, maybe it's that someone else is better resource to deal with it, then, handing over and passing it on to that person rather than just kind of putting your hands up at the beginning and saying, oh, this is too hard for me.
And are there, oh, sorry.
So then what becomes the alternative then? That's where a generalist who works in the hospital really sort of takes over. But one of the big barriers is that that's such a young concept here in Japan in terms of a hospital subspecialty in and of itself.
Yeah.
So a lot of hospitals just don't have that department at all. They're just not in place. So that's going to be a big project over the next 5-10 years. In fact, the Japan Society of General Hospitalist Medicine is really only about 4 years old. It just got started. And it's got a lot of enthusiastic people, but it's going to it hasn't quite taken root yet. So
That was going to be my next question, actually. Are there facets of the medical population that are starting to think this way? And I mean, are those practitioners in certain hospitals? And how are they sort of going about trying to promote that model?
Yeah. So like I said, so the Japanese Society of General Hospitalist Medicine was just established about 4 years ago. And a big advocate of that is a gentleman named Dr. Naito at Jintendo University, Dr. Shimizu at Tokyo University, and a couple of other places. Now, these docs, on the scale of doctors, they're not young. I don't want to say that they're young. They're well established doctors, but they're younger than some of the old sort of established heads. They're not yet in their 60s or 70s. So they are, relatively speaking, young, excited, very dedicated to this new movement, and they want to see it spread. So to that end, they've actually started collaborating with the larger internal medicine societies here in Japan. They're trying to be more active on the academic scene as well as on the practical community medicine scene as well. So it's a growing movement here. And, to that end, they need advocates and allies that are outside of medicine as well. People in government, people like Governor Koike, as many advocates and allies as they can have is going to really sort of promote the project forward.
Now, I understand that Hiro Hospital was sort of part of this pitch, or was it an example of a hospital where that perhaps have the capacity to start to move into this model?
Yeah, so Hero Hospital actually, as I think everybody probably knows, everybody who lives in Tokyo, it was one of the first hospitals to start accepting COVID patients, and many kudos to them for that. But no good deed goes unpunished, and they've really had a lot of nurse attrition. They really had a lot of staff attrition. So the hospital kind of, from what we're hearing, is in a little, it's in a little it's in a stress zone right now. But sometimes these stress zones are a good opportunity to make meaningful change as well. I don't know if Nick has a different perspective or has heard something different.
Yeah, no, I think this meeting at the moment was really just to try and I think raise awareness of the issue. So step one is just kind of going, hey, we've got a problem and that needs to be solved. I think for Governor Koike and most of the other high level officials there, they haven't really even heard the perspective that the foreign patients are having difficulties in Japan. So I think the real focus of our meeting was on just saying, hey, there are some people having issues out there, and just relaying some of the personal stories of people who are having trouble getting an ambulance, people who are feeling like they're unwanted at Japanese hospitals. I think the idea of Hero Hospital was that there would be a hospital which was focused on apply medicine for expats as well. I think at the moment a lot of Japanese hospitals, the sad thing is that because the international patients are a lot of extra work for them, they often see more negatives than positives in trying to expand their international services. They think if we make ourselves attractive, to the expat community, to the international community, we're going to end up with a lot of expats. And often that means, that there's going to be a lot of extra work, extra, translation, interpreting, dealing with cultural differences and stuff. So many of the hospitals are just not placed to kind of expand in their services in that matter. So it would be good to have a hospital, and particularly a hospital with an emergency department, that was a little bit more proactive in taking, international patients when they needed admission or emergency services.
Yeah. And do either of you have any contacts at Hero Hospital that has expressed any sort of interest in discussing this? Or we could
we've left that up to our benefactors and our senior colleagues. Now the political eggshells here is that radical change, and certainly radical change that is trying to take something that Japanese and make it look a little more quote unquote foreign, is always sort of fraught with emotions and political divides and all that stuff. So, you know, I anticipate that we're going to be treading very, very carefully as we, approach any institution in particular, here, a hospital or anywhere else. We want to, you know, nothing in Japan works when you try to sort of bull in a china shop it. So sort of going carefully and really working with the structure that's in place there right now is going to be absolutely key if it's going to be successful.
Was there any sort of reaction from Koike-san on what you were talking about? Did you gauge any sort of response in either direction from the interaction?
Yeah, look, I think she seemed interested. The meeting went for longer than it was scheduled, so that's always a good sign. Of course, being Japanese and a politician, being both, you're not really going to get a lot to read from the response because, of course, it was polite and measured.
Yeah.
But I think, we were successful in our main goal, which was just to bring this issue, to their awareness. That because I think up until that day, none of them had heard that, the international community was struggling to access acute, out of hours medical care, for example, or acute inpatient care, that they were having these cultural differences, these, often feeling like they were being discriminated against, or, feeling like they weren't having the kind of experience that is befitting to this country in every other aspect. When you go to a restaurant, it's amazing. When you go to a hotel, it's amazing. Sometimes when you go to a hospital, it's not amazing, and it's kind of out of sync with the level of experience that we're provided with elsewhere. I think now that, we've at least raised that issue on her radar, and then in future steps, trying to kind of gradually implement some change there.
Yeah.
One thing I got to say, and Nick, I'm not sure if you agree or if your sense was the same or different. I got to say she was a great listener. And that's something that's a little bit rare. I've sat in a lot of meetings with politicians, and it's a lot of sort of stone-facedness, whereas she was very interactive in her listening. And I say that to the sense of like, she seemed like a very active listener. She was giving verbal cues and feedback and nodding her head and, all doing all that stuff that maybe we're more used to in a dialogue in the West. And I found it so refreshing, but so different that it actually shocked me a little bit.
Yeah.
Now, that could be great political theater, of course, but there seemed like there was something genuine about it.
Yeah.
And I will say that she spoke amazing English. I was very impressed, at the quality of her English. And, she was willing to, to really enter some dialogue on this topic, which was great to see.
So what are the next sort of steps that you can see, I guess, on your behalf? Have you got anything in the works to start to sort of progress this forward, or what do you think that needs to happen next?
Nick, have you heard any follow-up here?
Nope. I mean, to be honest, that's kind of my expectation. I do.
Yeah.
I guess I'm not holding out that there is going to be drastic change, in the near term, and potentially Dr. Aoki's idea for Hero Hospital. I don't know how quickly that is going to move, or whether it will even end up being at Hero Hospital at all. But like I said, I think our main goal was just to try and raise this as an issue. And now once she's got that awareness, she's going to be a part of the Tokyo political scene for, quite a long time to come. The next time that someone kind of mentions to her about, dealing with international patients or whatever, I think she'll, reflect back on our conversations and go, oh yeah, I talked to those two, international doctors. And I remember them saying that, that people are a bit shocked when we get into an ambulance and it doesn't go anywhere for 30 minutes. Hey, maybe we should have a look at that. That kind of, I think that the awareness is there now. So even if there's no concrete steps from here, I'm happy that at least we could raise that issue.
Yeah, absolutely. I echo that and agree with that 100%. And, there is sort of a glacial pace of change here. And I'm hoping that, meetings like this are just those small incremental, moving of the ball forward.
Yeah, and I'm hoping that, as doctors, bilingual doctors who are working, we're kind of, crossing the bridge between, Japan and the international community. I think it's quite an important role to play to kind of be able to go into those meetings and say, hey, this is what's happening with the international community. And we found out that actually it is on one of the, the priority lists for, the goals of Tokyo kind of medical system was, internationalization. So we're there. We're on the radar.
On the radar.
Yeah. Well, yeah, I mean, good on you both for fighting the good fight and doing all this hard work to try and improve the level of medical care that foreigners can access here, but also trying to make steps towards improving the Japanese medical system as a whole. In the future, perhaps in maybe 2040 or so, we can get you back on for an update and see if anything has changed before then. But
we're gonna be here.
Yes, no. So thank you both for coming on again, and we'll look forward to speaking to you again soon.
Thanks,
you.